Thank you. Okay, I'm Jackie. This is Trish. So we are going to talk about some simple solutions to complex cases. So we'll go ahead and get started. So in Greenville, we are very lucky that we have all of our disciplines under one roof. So we really harp on and really strive to have a good, solid multidisciplinary approach, including our surgeons, us down at POPs, our therapists, and most importantly, around all that approach is the patient and the family. So I joke, but am very disappointed when I'm not wearing my watch to catch my steps because I spend a lot of time going up and down the stairs from POPs to therapy. So we really thrive on working together for our patients. Our objectives of this presentation, we'll present case studies that demonstrate some simple orthotic solutions focused on improving mobility, overall posture in young children with AMC that we've kind of been developing and working on over the past year. Um, all of these orthotic solutions we've actually had on multiple patients at this point over the years. So we've really kind of been working on it and harping on it. And then we'll include brief overview of the children's birth history, orthopedics interventions. We're not going to dive too hard into like the surgery and things like that and really focus on the orthotic care and the therapy aspect. So our first two cases are actually two girls. They're going to be the oldest the oldest patient case studies that we have in this presentation. And in a unilateral, meaning only on one of their legs, free motion joint KAFO. So a little different than kind of our normal prescription for KAFOs in our AMC population. So these KFOs have a single axis joint. They do have joints on the medial and lateral side, so the inside and outside. And a big reason why they work for these girls is the joint is actually behind the knee center, the anatomical knee center. So it kind of helps push the leg forward into flexion. So a lot of our kids were trying to, hold straight because they have flexion contractures, and we're trying to prevent that from reoccurring. And these girls have motion in their knees, and we're trying to enhance that, but we're really trying to kind of push them into flexion while ambulating. And all 3 planes taken into consideration. I kind of like to break orthotics into 3 categories of corrective, hold, and dynamics. One of the fun things, but also challenging things about AMC, it seems like we're at least doing 2, if not all 3 of those in one orthotic device. So we want to provide stability and reduce falls, improve pain if we can, and especially with our kids, delaying the need for surgical intervention as long as we possibly can. So for our first girl here, one of the other things that I've learned from Trish and that I know she really appreciates having is birth pictures to get an idea of where our patients have come from and kind of know what the deformities are that we're trying to fight against in orthotics and rehab, if you will. With this patient in particular, our past surgical interventions have included the feet and the hips, but she has not actually had any surgery done to her knees. And a lot of her orthotics in the past have not been done at Greenville. So she's a little bit newer in the orthotics aspect to us. And she hasn't had any surgical intervention since 2022 when she just had hardware removal. And she hasn't had any surgical intervention that's really affected her alignment since 2020, and she's 8 now. So some early interventions. We'll get to see if the video. So you can see one of her early interventions here is she has some little AFOs that Trish actually made her doing the French taping method. So on this one, there's a toy that she's trying to go get. Another thing that I really like to think about with orthotic devices is making sure that, especially with our AMC kids, that we're not taking away their mobility. I mean, they all move in such a unique way. I don't want to keep them from being able to do that. I want to enhance if I can. Or we need to think about kind of a wear time, like if they're doing certain activities, they may not be wearing the devices because it may hinder them from that in developing, especially with our babies. Okay, in this video, she is a few years old at this point, I think. I actually did not know that she had a free motion KAFO because we did not make them until this mom sent us this video. Um, and it was actually the family that decided to take the joints off the KFO, so because they were tripping, they were dropping a lot, and she was tripping over them. So they ended up taping them up. And she also at one point was in the ratchet KFOs to kind of hold her knees straight that we typically do with these kids with AMC. Okay, so these videos were actually taken only about a month ago. So we'll play her video now without any orthotic devices. Let's see if that plays. So, very functional. She can ambulate without bracing. Obviously, there's a lot of energy going there on her side to side, and she was complaining about she has 3 sisters, complaining about fatigue, not being able to keep up with them. Initially, she came, or not initially. So in the summer of 23. She came for actually a pre-op appointment, and the family wanted to delay surgery. So we were called over to kind of just see if there was any orthotic interventions that we could think of. And, we don't want to overbrace, obviously. I don't like when orthotic devices live in closets. So I want them to be usable. But she actually wanted to give it a try, a KFO, when it was mentioned, and she told me, she's like, yeah, I mean, I have another friend who has AMC, and she's in 2 long braces, and she does just fine, so I can too. So it's actually her and the family that wanted to really kind of proceed with that and give it a shot. So this is her with her AFO. She's in a PLS style AFO. So definitely improved, but with that left knee, she's having pain. Obviously, you can see that day in, day out of that, having fatigue, and we want to protect those ligaments as long as we can. We've also tried a shoe lift with her on and off, but every time she comes in and we decide to put a shoe lift, instantly we remember why we didn't go with one. So this is her with the KFO. So you can only get a small glimpse of them when they're in the hall. She, alignment wise, does look improved, but she has been in this for almost a year now, and she loves it every day. I mean, she wears it every day, and it's more of just the being able to be outside to keep up with her siblings, and like really at the end of the day, she feels like she's able to do a lot more. So our next one, another girl that she came to us when she was 5, so a little bit later, born at 39 weeks, minimal upper extremity involvement, right lower extremity involvement more than the left, and her early interventions included Ponseti, a hip abduction brace, and the ratchet KAFOs and AFOs. She does have forearm crutches that she doesn't like to use, and frequently leaves them everywhere. She's supposed to be wearing or using 2. Sometimes you could get her to use 1. So this is actually, she did undergo a surgical intervention to her knee. This was in October of 22, her pre-op video. So I'll let you kind of look at that because it kind of speaks for itself on that right side. So for her surgery, it had surgery to her knee and foot and ankle. A little bit from the front. And then she was in solid AFOs at this time. So obviously AFOs aren't going to affect the knee as much as we would like. So she having to go above that to get control of it. So she was 5 at this time. So she's 7 now. The next videos are only about a month old. So right after surgery, she was here. She was with us in Greenville for a week of intensive therapy. We did bilateral solid AFOs, and at that time, the discussion of a KAFO, since we had had good success with the girl prior, came about. But since she had just had surgery, only a week of therapy with us, and she has good therapy back home, we decided to try to kind of wait and see how she does. And then when she came back, it'd be further discussion. So obviously, like post-surgery, much improved alignment of that knee. Excuse me. And then, so we had her in solid AFOs. We did also talk about cutting them back to try to give her more motion and prevent some of that hyperextension. And then she came back, like I said, about 6 months later, and we decided her big thing was, like I said, she didn't like her crutches. She was having a lot of falls that her family was really concerned about, especially they do a lot of 4-H and being out on fairgrounds and things like that. She was tripping and falling and just overall fatigue throughout the day, keeping up with classmates. So in here, she's in articulated AFO, so a little bit more motion than right after surgery with her solids. Excuse me. And then, so our last one, we did fit her with the KAFO. She wears the articulated on the other side. She also wears her AFOs at night to keep from foot and ankle reoccurrence. And kind of same thing, like a much better alignment, but the biggest thing is from beginning to end of the day, endurance-wise, a lot better. Only wearing one, I think that these girls are happier wearing them, are more willing to wear them. Both of them choose to wear them. But in that knee joint, you can see is kind of it's behind the anatomical knee of the KAFO knee joint is, and that's kind of what's helping push that knee forward and keeping her from hyperextending. And she did report like less falls. Granted, she should still be using her forearm crutches, and can't convince her to do that all the time. Okay, then, all right, our next one.
Okay, I'm going to move right into our next case study. And this one is using a posture support TLSO, and basically with an infant, but we, well, you'll see from the pictures, but kind of like we're presented with a complex case of lumbar or thoracolumbar hyperextension. And so we're trying to work on getting like improved support and positioning. And this was not intended to like correct the scoliosis, but really for positioning. So, and again, that last comment of it's a fine line between support and allowing the infant to be able to move. So again, we were thinking of that as we did this. But again, this is our little introduction to this little guy. He was born at 39 weeks and was given a possible AMC diagnosis in utero. As you can see, he was transverse, kind of in a reverse C with that hyperextension. We had a telehealth visit early on, and then we met him at 4 months of age. And this little guy had a number of early interventions before he got to us, including like Ponseti. He had wonderful OT and PT in the NICU, and they used some things like a Z-foam positioner, and he had a little hip orthosis before we even met him. So again, just a couple more pictures of this little guy. The one on the left obviously is shortly after birth, and then a little older on the right. And then these were some initial x-rays that were taken of him. Again, these are just supine and AP laterals of him. He was 4 months old at the time. And then these are some pictures. The one on the left is without the TLSO on that Jackie made the one on the right is the 3D light TLSO that she fabricated, which you'll see pictures of next. So again, the one on the left is the 3D light, which really was a wonderful material to use on him because a lot of these kids get very warm. And so it's a little bit of flexibility to it, and it breathes well. So, and the way we work together on this one is obviously I don't know how to make the brace, but like we'll talk about positions and getting them in the best position that we can. And if you notice the right side, like we went longer on that side, on that flank, to try to kind of like move him out of that curve. Okay, and then the next one, we have 2 case studies for this one, but I feel like this one we slowly developed over a few years probably, and it's really simple. And a lot of our parents have actually come in with versions of it too, and we're finally like putting it together and kind of like fine tuning it. But basically, this was for our children who were born with wide abduction and like external rotation of their legs, which you'll see in the next couple of pictures. But and often when our physician is casting, whether it be for the feet or the knees, they were using like a removable bar. And I honestly remember one family was using a plastic hanger at one point and had kind of created their own way to bring the legs in together. And then we also started using Velcro straps, so like our knee immobilizers on our little babies that were undergoing serial casting for their knees, often to straighten them. And so again, they had that wide base of support. And so we were trying to get those legs underneath in preparation for possible standing and even for sitting posture. And then this, again, has just kind of evolved over the years with different types of strapping to the KAFOs once they're old enough to have a pair of those. So this is one of our little guys born at 37 weeks, diagnosed in utero, amyoplasia type with upper extremity and lower extremity involvement. We first met him when he was about 3 months of age. And then some of the early interventions that he had locally and with us early on were Ponseti, AFOs from low temperature aquaplast with the French method, which was me, and then some KIs, which were traditional and Benic. We also used hip helpers with this little guy early on to kind of bring those legs underneath him. So this is just a quick picture of him with some of the French method taping and then the aquaplast splint or AFO on the right side, which we used early on. And then this is a little video, and honestly, this is him and his AFOs, his Benic knee immobilizers, after some stretch casting to get his knees straighter. He did not have any surgery on his knees at this point. And we just added a strap on the top. Oops, I might need help with it. There's the video. And again, we're trying to, as Jackie said, and a lot of people have been saying this past couple of days, is just allowing him to move. Okay, and then he got a little older and we were able to fit him with KAFOs. He was long enough to go in those. So this was following some more surgery and casting. He was about, I'd say, not exactly sure, maybe 2 at this point or close to it. And this, honestly, this strap that's on him right now was a strap that his parents made when he had casts on. So it's circumferential and it's elastic in nature. And I was trying to get him to walk, and I was having so much trouble keeping his legs together that they just like handed me this strap that they were using. And so we put it on, and we're giving it our first try here in this video. But it really was like a second set of hands. And I also, like Dr. Heyer said, we rarely do. She said to us once when she saw this that it kind of takes away the need for HKFOs, which we really don't like to use, which are the braces that go above the hips because they're really bulky. They really are hard to sit in. And so this little strap kind of helps keep the legs together in a way with just KAFOs. So it's trying to like decrease some of that bracing. this video here is, we kind of advanced from that circumferential one to what we've been doing more of lately, which is using a smaller strap of different, we use different tension and different pliability, but it goes between the medial struts of the KAFOs. And again, we really have to play with this with different lengths. This was his first time ever like walking with a walker. And again, it kind of allowed us to use less support of the walker and kind of kept his base of support narrow enough that he could manage it. So again, just kind of another view of this. Okay, and then this is our second little girl, born in a very similar position to that last little guy. Mom was diagnosed with the intrauterine growth retardation during pregnancy. She was diagnosed, this little girl was diagnosed with AMC at birth. Again, amyoplasia type with upper extremity and lower extremity. And then she was first seen at our facility when she was about 2 years and 9 months of age. And then some of her earlier interventions, you know, before us and with us were like Ponseti, serial casting of her lower extremities. She had hip helpers, KAFOs, and AFOs by the time we met her. Okay, and this was a video taken of her at Shriners. She had had surgery on her hips and her feet at this point at another facility, and then came to us at this point. So it's just a little like video of how she moved before. But you can see that really wide base of support still, and the wedges on her shoes that kind of accommodated for the knee flexion contractures still. I'll let this play just a little bit longer so you can get an idea of how she moved. Okay, and then this was following like a lower extremity surgery. And like Jackie said, we really didn't want to get detailed with the surgery because it would be overwhelming, but she had had surgery at this point to address her knee flexion contractures. So she had had releases with femoral shortening and a hip flexor release at this point. And this is a little video of us like getting her up for the first time in just KAFOs. Which is really wonderful, but you can see that wide like circumduction, how she comes out really wide to get around. And again, if you think back to that birth picture, you can kind of understand why. That's a little bit better view of it from the back. And then this was most recently, it was again following another like smaller procedure, but we had decided to try to add the medial strap that was kind of newer to us. So that's her on the left from the back using that strap. And again, we're just really trying to get those legs underneath her better so she has better balance. And then this one is just from the front. But that was the first time she had walked like without someone holding on to her. Sorry. Okay, and basically that's it. And really, I think the whole point of this was just a few small examples of little things that have been brought to us by parents or that we've thought of that over the years. But the main point is the collaboration that we hope that we're doing at Shriners in Greenville. And we, again, feel really fortunate that we get to do that and really grateful that we get to be on these journeys with our family, and also really grateful for AMCSI for bringing so many professionals and families together for the ultimate collaboration. But thank you very much.
Yeah.